Hi guys, today I bring you the simplified version of the assessment station of the APIE when it comes to the OSCE. Come closer, let's talk about it. When we talk about the assessment station, it's basically doing your A to E assessment on your patient based on the scenario plus the holistic assessment of your patient depending on your scenario as well. So during this station, you'll be presented with patient condition, a scenario, and patient presenting complaints, drug history, allergies, and patient biodata. So in this case, as OSCE custom demands, you start with your scene safety, you provide privacy, you do a quick hand gel without verbalizing it, then you proceed to introduce yourself, then you gain consent. That is, you introduce yourself and you tell the reason why you are there, then you also gain consent from the patient. After that, you proceed to do your ID check. Yes, ID check entails a lot. You do your ID check, then you do your pre-checks. After your pre-checks, you address any traps. If there are any traps, you address them. Then you proceed to hand over the call bell to the patient to go and prepare your articles and come back to start your ATE assessment. Right after handing over the call bell to the patient, you move on to do your WHO hand gelling. You use the 8 steps that involves the WHO hand gelling. After that, you verbalize that your equipment are safe, well calibrated, and also good for you to use. Proceed with your A2E assessment. We start with airway. Under airway, you check for 3 things. Then after checking your airway, you proceed to breathing. Under breathing, you check for 3 things. After breathing, you proceed to circulation. Circulation, you check 5 things under circulation. I said, yes, you check for 5 things under circulation, then you move to disability. In disability, you also check for 4 things under disability. After disability, you proceed to exposure, where you check for another 3 things as well. So exposure, you check for 3 things, then you proceed to calculate your news or your total news score, then any other document that might be added during your assessment stage. So in the assessment, you can then have the news chart, the GCS chart. You can also have additional charts such as the 6-6 chart or the PHQ9 chart or the must chart. Anyone that is in addition to your news chart, any of which you are presented with or you are given, you calculate the total score and present it back to the patient. Proceed to do your holistic assessment. During your holistic assessment, talk about physical needs, family needs, social needs, and any psychological needs. After that, you proceed to ask the patient if they have any specific concern that they want you to address. Right after that stage, you move to the stage where you verbalize to the assessor that all your equipment will be clean and safe for next use. Then you do your final WHO hand gelling where you are not going to verbalize. So I think this is helpful to all of us. If you need more of this, subscribe, continue to share our videos, and also like them.